Today's live session, everybody. We'll just take a moment to share the link with everyone and invite everyone to the live session. In the meantime, if you have any questions related to diabetes, you can just send us that in the comment section, and we'll take all of those today. It can be related to weight loss, it can be related to other intricacies of diabetes. Hi, Dr. Dilip, welcome to the channel.
Hello.
Hi, how are you, sir?
Good. How are you?
I'm doing well. So welcome back to the live session, and it is always fun, and it's an honor to have you always with us. So I just gave an introduction that we'll be discussing all about weight loss during the diabetes journey today. So we have a lot of people from the diabetes community, and we have a lot of people from the women's community also who have diabetes and are struggling with this condition of weight loss. So we will discuss all about that with Dr. Dilip today. So
Right.
welcome, sir. Thank you so much for coming. Okay, so we can start.
Yeah. Go ahead.
Okay, so I have a very basic question first, starting from the very basic. What are the primary reasons? Can you hear me, sir?
Yeah. Now,
Okay, should I repeat the question?
please, you too. Yeah, I didn't hear the question.
Okay, so what are the primary reasons behind weight loss with individuals dealing with diabetes, and how can one distinguish between intentional and unintentional weight loss?
Yeah. So there is a thing called diabetic cachexia, where people tend to lose weight because of increased blood sugars. People who have sugars beyond 300, 400 and all. There is a thing where there is an increased osmotic diuresis that occurs, and over a period of time, there is muscle wasting, there is fat that comes down, and people start tending to lose weight. So that's called diabetic cachexia, and that occurs in people who have had diabetes for a long period of time, and they don't have good sugar control. So that is basically unintentional weight loss. And then, of course, intentional weight loss is again different. That is a different aspect of it. When you're trying to reverse diabetes or control diabetes better, then when a diabetologist recommend weight loss as a part of sugar management, then that actually helps improve or reverse diabetes. So that's a different part. But then unintentional weight loss is something serious. We need to probe and identify if there is anything if it's all benign or harmless, or if it's only high sugars that are causing increased weight loss, then the degree of weight loss, then the quantum of weight loss, and then how high the sugars have been. So this is all related to diabetic cachexia. Yeah.
Okay. And what are the potential health implications of unexplained weight loss in diabetes? And when do you think individuals should go to a doctor and seek medical attention?
Yeah. So it's also about the quantum of weight loss, the delta, the drop in weight. If it is significant, usually when we say weight loss, it is significant weight loss means 10%, more than 10% of weight loss. Say someone who is 75 kgs, then we're looking at 7 to 8 kg weight loss or more in say 4 to 5 months. That is significant weight loss. So if that is occurring, then one needs to go inquire and make sure their physician checks if all parameters are normal. If someone is having good sugar control, but then they are losing weight so much, then it may be something to do with concomitant tuberculosis infection, tumors. These are all a little rare, but then they will have to get screened for these particular things, because these can be dangerous. So one needs to actively probe for such unintentional weight loss, which is more than 10% of body weight, and then when physician tells the particular patient that okay, there is a group of medicines called SGLT2 inhibitors, or and there's another group called GLP-1 receptor agonists. So you have drugs called empagliflozin, canagliflozin, or dapagliflozin on one side, then liraglutide, semaglutide, or dulaglutide on the other side. So these medicines also cause weight loss, but this is intentional weight loss. As we all know, there's about 8 or 9 out of 10 diabetic patients in India. They are either overweight or obese. So these medicines are actually given to cause weight loss. So when you are giving these medicines, and then this is intentional weight loss, which is agreed upon when the physician or a diabetologist explains to the patient that when you tend to lose weight of this much magnitude, your diabetes is going to improve, or the number of medicines that you need to take to maintain your fasting post-lunch control, those number of medicines will come down when you are getting your weight down by these classes like SGLT inhibitors or GLP-1 receptor agonists. So when someone who is on these two classes of medicines, they tend to lose weight. Again, the quantum of weight loss depends on how much the baseline weight is. Someone who is 130 kgs, for example, to begin with, they tend to come down to even 90 or even 80 kgs over a period of 1 to 2 years. But then someone who is, say, for example, 80 kgs or 75 kgs, they don't tend to lose that much weight. So when these classes of medicines are used and then they achieve the degree of weight loss, say, for example, whatever the weight loss delta is, but then after such a point, say after achieving the normal weight, and I'm sorry, there was a phone call. So after achieving normal weight, if patients tend to lose further, then that is something physicians or diabetologists need to probe for. That, like I said, tuberculosis, then infections, then decreased appetite, and any other particular cause that needs to be probed. When these particular the weight loss that is accountable for these particular classes of anti-diabetic medicines is noted for, then something beyond that, if there is someone is losing weight, then that needs to be probed and diagnosed.
Got it. And how does the weight loss impact the blood sugar levels of people? And does it also impact the overall diabetes management in general? And if yes, then what can individuals do to, employ it and manage it and stabilize it?
Yeah, so WHO and even American Diabetic Association, for the last 4 years, there's a strong emphasis on anti-diabetic medicines and their need to at least maintain weight or cause weight loss. As in, like we just discussed, these two classes, SGLT inhibitors on one side, GLP-1 agonists on the other side, metformin, acarbose, you have saroglitazar. All these anti-diabetic medicines are known to cause some degree of weight loss. Some of them are weight neutral, like gliptins, for example. But then if someone who is obese or overweight, as in if their BMI, if an Indian patient is classified, is characterized as overweight, if BMI is 23 to 25 overweight, then beyond 25 it is obesity. So when people who are patients are overweight or obese, then important that they actually should lose weight, which is actually a part of treatment of diabetes itself. And now when this happens, when patients tend to bring their weight down from their higher BMI, from say 25, 28, 30 BMI to normal, say 23 or less, 22.9 or less is normal BMI, 18 to 22.9. Now, when you bring down your BMI, the chances for you to become a pre-diabetic or a non-diabetic, the chances are pretty high. So if you're a young patient, you're obese, and then your doctor tells you that you have become a diabetic, and then when you become a normal weight individual, when your obesity or overweight comes down and your BMI is normal, then there's a very high chance you may become a non-diabetic. So that is very much possible, and that is actually, in fact, the drive why the guidelines are actually pushing for weight loss inducing anti-diabetic drugs. Now, say for example, someone who is a normal weight diabetic, for example, BMI is normal, but they are a diabetic, and you are giving these classes of medicines like SGLT inhibitors or GLP-1 RA, your weight may may not come down drastically. There may be modest 1 or 2 kg weight loss, but then these class of medicines have benefits like heart and kidney benefits. As in, you are going to protect your heart. The risk of heart attacks comes down drastically. The risk of kidney disease also comes down drastically when you are using these medicines. So weight loss inducing anti-diabetic medicines is this property is a need of the hour, and because 9 out of 10 diabetic patients across the world are either overweight or obese, the need for weight neutral or weight loss inducing anti-diabetic drugs is very much there. And like I said, normal diabetic patients need not worry about the 1 or 2 kg modest weight loss that these classes may cause. But as a whole, when you lose weight, when you are overweight or obese diabetic, it is actually a good thing.
Right. And we always emphasize on the lifestyle changes when it comes to diabetes, whether it's about, losing weight or, practice going, like doing physical activities to bring down your weight. Are there also any specific diet or dietary restrictions or recommendations that are tailored to individuals experiencing weight loss in diabetes? And how can meal planning be adjusted accordingly?
Yeah. So now patients who are losing weight intentionally as in when their doctors have suggested that they should lose weight, and if it's all going well as per plan, say 3 or 4 kg weight loss until they become in a normal weight, as in normal BMI. In that case, it is a good thing. But then when you're talking about diet in a overweight or obese patient, the focus is all on complex carbohydrate diet. Okay, need for diet that is not easily digestible, as in, for example, idli and the kind of simple carb diet with high glycemic index that we eat. Now, all these needs to be avoided in a diabetic patient, because you want increased intestinal transit time for diabetic patients, as in complex carbohydrates are preferred. Your gut, your gastrointestinal system needs to take some time to digest and absorb the food, rather than getting assimilated and absorbed immediately, like high glycemic index foods. So the focus should be on low glycemic index, complex carbohydrate foods, high plant protein, then high fiber kind of diet, veg salads, then nuts and seeds, chana dal, for example, all dals and legumes and plant protein, soybeans, peanuts, almonds, then nuts and seeds, and all dals and green leafy vegetables. Soya, tofu. All these are definitely encouraged, and milk and curd, that is 2% of toned milk, can be taken. So brown rice rather than white rice is encouraged, and multigrain kind of foods are definitely encouraged. Rotis without oil, and then the portion size needs to be brought down. And instead of having 2 rotis, for example, 1 roti, but then if you're hungry, eat more and more of vegetable salad. Take 1 or 2 egg whites if you still feel hungry, because if you take protein food, you're definitely less likely to be hungry, and then snacking comes down, because in diabetic foods, snacking is an important risk factor actually. The 11 a.m. or 5 p.m. These are times where patients tend to feel hungry, and then they tend to eat whatever is available. So make sure the snack that you're going to eat is healthy. It's not going to increase your spike of sugar. So it is a complex thing, diet, but it is an integral, important pillar of sugar management. In fact, diet and exercise constitute 60 to 70% of diabetes management. If you have a healthy diet and exercise, the number of medicines, number of anti-diabetic drugs that you are on, and then even the dose of anti-diabetic drugs can be brought down significantly.
That is an amazing insight on the diet management. Thank you so much. And what role does medication management play in addressing weight loss concern in diabetics? And how should treatment plans be adjusted according to that?
Yeah. So if you are on weight loss spree, as in you're now, until say a few months ago, you were happy with your weight loss, but then if it's crossing, meaning you're getting leaner and leaner, and you don't want further weight loss, but your sugars are well controlled, then there are these two classes. One of it can be stopped, as in the SGLT emitter plus GLP-1RA. One of it can be stopped. You can be on a gliptin and a SGLT emitter, and then you can take protein-rich diet, plant protein-rich, that is, because animal protein comes with its own baggage of saturated fats, and you can probably overshoot your weight goal. So you don't want to do that as well. You don't want to gain weight as well, but then you will have to maintain your weight. And if you're unintentionally losing more weight than your diabetologist has recommended, then it is really important to have increased plant protein in the form of all the dals, legumes, beans, and then of course egg white is a good protein supplement, protein food. Then also fish and chicken, they're okay. But red meat is supposed to be stopped by every diabetic patient. Red meat is not at all recommended. It comes with a lot of problems, as in long-term use can cause see a prostate, there is carcinomas, and so red meat is directly linked with heart disease, also heart attack risk. So white meat, that is fish and chicken, can be had, but then of course it should not be fried. Any of the foods that we discussed, it should not, once you fry it, the benefits are actually gone. So fried food is completely not recommended. And when you're going to have foods, increase your plant protein intake, increase your fiber intake, bring down your carbs and fat intake, and that itself can help you maintain your weight. If you're losing more than intended, that is again, that may be a problem. And rarely, when you're using all these and you're still losing weight, your doctor can recommend you a sugar-free, sugarless, protein supplement. And there are so many protein powder supplements geared for a diabetic patient that are available. And of course, before starting that, you need to look at your kidney and if there is any proteinuria or not. If your kidneys are excreting more and more protein, then you may have to be on a different kind of a kidney-friendly protein powder may need to be given to you. So run it by your diabetologist or your physician. Then let them guide you as to what kind of a protein supplement you need to be taking.
All right. And when somebody starts losing weight or any drastic changes happen in their body, there comes a psychological stress. So can you discuss a little about that, about the psychological aspects that are related to it, and including the emotional challenges, and how can the caregivers and how can the support system help and navigate this
Yeah.
journey with the patient together?
So most of the time, probably 8 out of 10 times or 9 out of 10 times, when patients are losing weight, it is a good thing. And patients need to understand that. And they are concerned about how they are looking. I mean, of course, the facial fat comes down. There may be a aged kind of look, and relatives and family may keep asking, "What is wrong with you? Are you okay? I mean, is there something, some kind of a thing? Do you need to see a doctor and all that?" So yes, there can be an undue limelight or a focus on oneself when they start losing weight more rapidly, or there can be undue attention. But as long as it is in the healthy, normal BMI range, patients need to understand that it is a good thing. And please run it by your physician. Tell them that this is a concern. How much weight loss have they encountered in the last few months, for example, and then let your physician assure you. Because if you're in the normal BMI range, then if you were, for example, overweight or obese before, say 1 year ago and all that, then you should actually be happy about your weight loss. The cosmetic appearing thing, I think that can be taken care of by dermatologists, or there are so many ways to make sure the aging, rapidly aging kind of look that you may get from losing weight, that can be tackled. But then if you're going into the underweight BMI, if your BMI is less than 18, then that is where doctors can help you. You can probably be on a high protein diet. You can take protein supplements and all that. So firstly, you need to get reassured by your treating doctor. Your physician needs to understand and maybe do some tests and show you the results of those tests and reassure you. Because like I said, 9 out of 10 times for a diabetic patient, who was overweight or obese and now normal BMI, there is absolutely nothing to worry about. In fact, you should actually rejoice. It is a good thing. But psychosocial wise, if patients tend to get depressed about how they are looking and they are worried about their underweight thing, then of course doctors can help them by doing some investigations where there are two important things that anyone needs to worry about. That is tuberculosis or cancers, the tumors of any kind. And we can get a whole body PET scan, or you can see if there is a tuberculosis anywhere, because TB does not necessarily come with the baggage of fever, night sweats, and all those, because there's so many times where tuberculosis need not when present with the fever, cough, and all that. In fact, there are extra pulmonary manifestations of tuberculosis where there won't be any fever or cough. So your doctor may need to work up and establish and show that there is no other underlying cause, that is causing the weight loss. So when those things are, those data is presented to the patient, I think that is definitely reassuring, and psychosocially they can definitely understand that, and whatever depression or anxiety that they are having about their undue unintentional weight loss, that can be addressed by the results and reports. And like I said, most of the time, 8 or 9 out of 10 times, it is a good thing when an overweight diabetic patient loses weight.
All right, got it. So that were all the questions that my team had. I can see section. I'll just diabetes with weight loss as a dietitian. We do face plateau. We do advise detox diets, low carb diets, but without stucks. I don't know if I'm pronouncing this right. How to handle this with linear weight loss?
So I think the crux of today's presentation is, if there is intentional weight loss, if the physician diabetologist is suggesting weight loss and patient is coming to the normal BMI, it is always a good thing. But if the weight loss progresses to underweight, under normal BMI, then during that time there may be some tests that are required. I'm getting some resound now. Yeah. So I think the crux is that, I mean, there are so many times where most of the time, because normal BMI diabetic patient is probably 1 out of 10, while 9 out of 10 are always overweight or obese. So once you understand, when you come down to the normal BMI range, which is 18 to 22.9, do not worry about your weight loss. But if you are overshooting it, as in if you're becoming an underweight patient, then that might need some workup. We might need to look at why or what is causing that particular weight loss, and probably help you with increased protein, decreased carbs and fat, and increased fiber and protein, and then that will definitely help patients maintain their blood sugars, and then of course most of the time you will not find a red flag like diagnosis which may cause this particular weight loss. That is, like I said, tuberculosis, then HIV, then cancers and all those.
So that was your answer, Kapila. If you think you need more insights on it, you can maybe frame the question in a meta way and send us on our DM. We'll definitely connect with Dr. Dilip and get your text answer on it if there is any query. There is one more question. I'm not able to understand the word, but maybe you can take it up. Pathogenesis of complication of diabetes.
Yeah. So there are 3 to 4 fundamental ways in which increased sugar leads to, the complications. Retina damage, kidney damage, nerves damage, that is retinopathy, neuropathy, nephropathy, and then heart disease and stroke and peripheral vascular disease, diabetic foot, infections, cellulitis, gangrene, and all those. So the fundamental aspect of this is advanced glycosylation end products. We call it AGE. Of course, there are 3 other pathways that are, it goes into a very fundamental thing which may not be understood by common laymen and all. So when increased sugars over a period of time, they cause these AGE, that is AGE means advanced glycosylation end products. These tend to cause the damage. There is sorbitol related damage. So basically, the glomerulus, the glomeruli of kidney, which are fundamental, nephrons. Basically, they tend to excrete the waste products, filter out the extra fluid in the body. Then when it comes to retina, you add hypertension to a diabetic patient, there is accelerated retinopathy. So I think the fundamental damage, the pathophysiology is all AGE, and there are three other fundamental things that may cause damage. But yeah, increased sugar is going to damage probably every vital organ there is in the body, including blood vessels, the arterial tree, then liver also, then pancreas. So apart from the major organs that I discussed about, retinopathy, nephropathy, neuropathy, heart disease, stroke, peripheral vascular disease, and all.
I think those were the questions that we had from the audience. Thank you so much for answering that. Um, Somebody has a feedback that it was a really informative live stream and they got to
Thank you.
know a lot about it. So thank you so much, Dr. Dilip. That
Thank you.
was all that we had for today. Thank you so much for coming and joining us every time when we call you.
Thank
And
you for having
it's lovely to connect
me.
with you.
Likewise.
For all the people who joined us, thank you very much for joining in. THIP Media, like takes all the queries that you have on diabetes. You can just follow us on social media and you can follow Dr. Dilip on social media. His account is linked right here and we'll personally send it to you if you need it. If you have any other questions, you can anytime come back and DM us and we'll make sure you get your answers at the right time. So thank you so much, Dr. Dilip. It was lovely having
Thank
you.
you.
Thank you so much. We'll connect again.